Millie is an 81-year-old widow who lives by herself. She relies on her 55-year-old daughter and her 30-year-old grandson to assist her with basic household chores, shopping, and other errands. Millie has COPD, which is well managed with inhaled corticosteroid medications. At a recent appointment with her primary care physician, Millie disclosed that she had not been taking her medication in recent days. Upon further discussion, Millie explained that she gave her grandson money to pick up her recent prescription refill, but he never returned with the medication. Millie explained that her grandson has borrowed money from her in the past on several occasions without her authorization and has not repaid her. He once even forged her signature on a check. Millie has been reluctant to say anything about her grandson's behavior out of fear of getting him in trouble. Today, we're talking about elder abuse. It's the care you deserve. It's the care they deserve. Engage. Upon completion of this module, you'll be better able to differentiate the various types of elder abuse and elder self-neglect, define the scope of the problems of elder abuse and elder self-neglect, and describe the complexities of assessing and responding to abuse and self-neglect, detect the warning signs of potential elder abuse and elder self-neglect, review the screening and assessment tools for elder abuse and elder self-neglect, and explain the role of interprofessional care teams in responding to elder abuse or self-neglect. Elder abuse is defined as the physical, sexual, or psychological abuse, as well as neglect, abandonment, and/or the financial exploitation of an older person by another person or entity. Elder abuse may occur in any setting, such as at home, in a facility, or in the community. It occurs in a relationship where there is an expectation of trust and/or when the older person is specifically targeted based on age or disability. Multiple forms of elder abuse may occur at the same time. According to one study, 49% of abuse cases are neglect. Neglect is defined as a refusal or failure to fulfill any part of a person's obligations or duties to an elder. 35% is emotional or psychological abuse. Psychological or emotional abuse is defined as inflicting mental pain, anguish, or distress on an elder person through verbal or nonverbal acts. 30% is physical abuse, which is defined as the use or threat of the use of physical force that may result in bodily injury, physical pain, or impairment. 26% is financial abuse. Financial abuse is the illegal or improper use of a vulnerable adult's funds, property, or assets. 4% is abandonment, which is the desertion of an elder person by an individual who had assumed responsibility for providing care for the adult or by a person with physical custody of the adult. 1% is sexual abuse, which is non-consensual sexual contact of any kind. Abuse doesn't always involve two parties. Self-neglect is an adult's inability due to physical or mental impairment or diminished capacity to perform essential self-care duties, such as obtaining essential food, clothing, shelter, and medical care, obtaining goods and services necessary to maintain physical health, mental health, emotional well-being, and general safety, or managing one's own financial affairs. But keep in mind that lifestyle choices or living arrangements alone don't prove self-neglect. Self-neglect may occur simultaneously with other forms of elder abuse and may precede or follow an elder's victimization. Elder abuse and self-neglect occur among older adults regardless of gender, race, or ethnicity, living arrangement, health status, and socioeconomic status. There are no definitive statistics on the occurrence of elder abuse or self-neglect. In 2015, the CDC estimated 1 out of 10 persons over the age of 60 and living at home experiences abuse or neglect. Abuse is often missed by professionals who lack proper training to detect it. Elders often do not want to report abuse because of fear of retaliation, lack of physical and/or cognitive ability to report, or because they do not want to get the abuser in trouble. Financial exploitation is self-reported at a rate considerably higher than self-reported rates of emotional, physical, and sexual abuse or neglect. Self-neglect is among the most common reasons for investigations. Elder abuse and self-neglect result in significantly higher rates of psychological distress and health problems, including bone or joint problems, digestive problems, chronic pain, hypertension, and heart problems, and a 300% higher risk of death when compared to those who had not been abused.